Hey everyone, Jen here. I know it's been a little while since I did a video on social. It's just been a little bit busy and it's a little bit hard recently in healthcare. As many of you all know, there's so much going on that I have to talk about, but so much is happening so fast. And I just wanted to take a minute to reflect because I think many of you know that as a pediatrician, as a neonatologist, even as a medical educator, a disability health equity advocate, I have been an advocate for children's health care for a really long time. Many of you know that I actually was a national ambassador for Speak Now for Kids, which is a grassroots effort to help ensure that we support kids' healthcare, access to healthcare. And, back in 2014, I actually had the opportunity to introduce on Capitol Hill a very important bill called the ACE Kids Act. And that act was really focused on ensuring that kids across our country had access to healthcare. And in particular, kids had the ability to cross state lines to receive the appropriate healthcare that they need when they had a specific, complex, rare, or life-threatening medical diagnosis. So what do I mean by that? Well, when I was growing up as a kid with a skeletal dysplasia, my parents were very fortunate to have found an orthopedic surgeon in Baltimore at Johns Hopkins, Dr. Stephen Kopitz, who early on in his career dedicated his career towards caring for kids like myself. And it's because of him that all of the surgeries I had were successful and able to allow me to breathe without scoliosis impacting my respiratory needs, that I was able to stand straight and walk and move around so that I could become the physician that I am today and lead a healthy, happy, and productive life. And really, at that time, there were no other surgeons that knew how to care for kids like me. And in fact, my parents had met other families who kids had seen very well-intended, very intelligent, capable surgeons who were great at their field, but not experienced with kids who had skeletal dysplasia like me. And what ended up happening, sadly, is many of them had really bad outcomes, paralyzed or even lost their lives, because those doctors just weren't familiar with their unique healthcare needs. And so for many kids, the majority of kids who need health care, they have medical complexities and need to be able to get access to that health care so that they can live long, happy lives. And so it's because of my own personal experience and seeing the value of getting good pediatric health care, and because of my role as a physician, a pediatrician, that making sure that all kids have access to good health care has been a lifelong important goal of mine. Well, what I wanted to talk to you about today is that my biggest concern is that the upcoming potential cuts to Medicaid is going to have a big impact on kids. I don't know if you know, but 50% of our kids in this country rely on Medicaid for their health care insurance. Otherwise, they have no health care insurance. Imagine being a child and not having access to health care, whether or not you break a leg skating or running or riding your bike, or whether you have cancer and access to therapies are life-saving, or if you have a unique and rare, disease like I have, and that access to healthcare can be the difference between life or death, or just even having the ability to be a productive grown-up, right? Like, I have a great job. I'm able to raise 2 kids. I'm able to help others and save lives through my work. So again, healthcare is critical. And what many folks don't realize is that this potential cut to Medicaid is going to put so many children, up to 7 million kids in our country, at risk of not having access to healthcare. And the hard part is that there's nobody to speak for kids, right? They can't go and protest or advocate for themselves, it requires all of us, their parents, their loved ones, and those of us that care to speak for kids. So I hope you'll help me and speak now for kids. Tell your congressmen, your congresswomen that access to healthcare is important for our kids. They're our future, and they can't speak for themselves. So join me today. I thought I'd share a little personal story about why Medicaid funding is so important for kids, because not all of us know that. I didn't know that until I got involved in medicine. And, for example, the children's hospital that I work at and all the many children's hospitals that I have, 40 to 60, maybe even 70% of the kids that, come to a children's hospital for care actually have Medicaid as their insurance. And so not only will cutting Medicaid impact, up to 7 million individual children, it will also potentially have a dramatic impact on their access to care, because children's hospitals that have that expertise to care for kids, because they're not little adults, will also, they rely on Medicaid funding to be able to keep their doors open. So join me today. We can make a difference. While we all want to, have tax cuts and improve the debt and make reform, we don't want our kids to suffer. All right, take care. Happy Friday, everyone. And sorry about the wet hair.